So what about interventional therapy? This is a big change. We're going to blitz through this for time purposes. You basically can either locally deliver TPA or you can do disruption of the clot and suck it out. All kinds of devices. They look different things. Some have stents, some don't. Mr. Clean trial was the one that really opened it up. This was a robustly positive study that a lot of people actually received TPA as well. And despite that, they actually seemed to do better. There were problems with this. A lot of people talk about endovascular therapy for stroke like it's this great cure-all. It turns out this is only going to work for a very small subset of patients. It turns out about 98% of strokes would not qualify for these studies. Okay, so maybe 1 in 50 people are going to qualify for this. Very small number of strokes because you have to have proximal MCA strokes and people with severe symptoms. Not a lot of strokes actually fit that, but it's actually a pretty good study. The ESCAPE trial was another one. Very similar findings. There's really rapid intervention in this one I want to point out. Like you're talking 84 minutes to get to the endovascular suite, which is just lightning fast. I don't know how they did it. Extend 1A is another one, and they actually used imaging to select it. This is where you started finding that data that you really need to start using imaging to find out who benefits from it, and the SWIFT Prime study as well. So all of these were kind of coming one after the other that kind of showed that it was actually a good thing to do endovascular for a select group. Very biased studies here because a lot of them were stopped early. Once Mr. Clean came out, they just kind of cut their studies off and said, hey, does it look positive? And they looked at it and said, oh yeah, it looks positive. And so they just stopped. So there's some problems statistically with it, but I think that the preponderance of data with these new generation of devices show that it's probably a good thing. My problem with it though is, will this work everywhere? And the answer is absolutely not. Okay, it's very time dependent. They actually have a better evidence for time dependence for this than other things. And so if you have a stroke in Burke County, what are the odds that we're going to get you over here and get you into the endovascular suite quick enough to fix you? And it's fairly low. And this is much, much harder to get a qualified group of people for than say like a STEMI lab. And local community places are having a hard enough time getting cardiologists that can stent hearts. The idea of getting advanced neuroradiologists that can stent brains is just a pipe dream for much of this country. So this might be something for big metropolitan areas, but it's not going to fix a lot of the people out in the country. So it's a very, very small minority of folks.